Ever since I was a little kid, I really liked math and science. And my father was a dentist, and kind of was always something in our house that the medical profession was kind of interesting and helpful to people. And I liked hearing stories about my dad's practice and patients he was helping. And he thought dentistry was great, but was not pushing dentistry for me, thought medicine was a better field. So kind of the direction I went just from growing up. When I was in medical school, my kind of thought was to be a surgeon. I just liked the idea of physically doing something, physically kind of cutting out bad things and repairing. Having said that, during third year of medical school, when at Columbia we did our hospital rotations, my first rotation was in internal medicine, which is obviously not surgery. But I really liked internal medicine. I liked the patient contact. I liked the puzzles, trying to figure out what was going on, and get a bunch of tests and decide where to go from there. I really liked internal medicine. And then when I got to general surgery, I didn't like a lot of aspects of general surgery. That you really didn't get to know your patients very well a lot of times. You saw them and then you took care of it, and then they went off. And that kind of turned me off a little bit. So there's something called the surgical subspecialties. Specifically, the main ones I was most interested in was ophthalmology, ENT, and orthopedics. And I really liked all three of those because you got to do surgery on whatever organ system it was. You got to take care of the medical problems. You got to know your patients over the years. And of those three, I just thought ophthalmology was the most elegant. You use microscopes to do surgery as opposed to saws and drills. And it was working on the eye, and I just thought the eye was really a fascinating kind of organ to work on, and really helped people. I mean, not that the others don't, but ophthalmology is really a wonderful field. So when I got to my residency at Wills Eye Hospital, you go through all the different subspecialties, and I really gravitated towards cornea. I liked the fact that you could just look at the slit lamp and see exactly what was going on, as opposed to some of the other specialties. For retina, you had to look in the back of the eye, which wasn't so always easy to see. For neuroophthalmology, it was even further than the back of the eye. You had to get a lot of imaging. I really liked the idea that you could see what was going on right away. Also, at the time that I entered residency, the field of refractive surgery was basically beginning. Radiokeratotomy had been around and was kind of going through a second life, and then excimer laser surgery, which later became PRK and LASIK, was just being developed, and I thought that was a very interesting field to go into. As it turns out, cornea transplants hadn't changed much in the previous 20 or 30 years, but in my lifetime in cornea, they have changed dramatically. So it's really been a wonderful subspecialty to be in for the past 25 years. Well, when I was a medical student at Columbia, I looked around at all the different residency programs, and Wills was one of the highest, if not the highest ranked residency program. So I became a resident at Wills. And then I did a fellowship in cornea in Iowa City, Iowa, but my dream was to come back to Wills. And the question is why? And the answer is, Wills is just a special place. It's a special place for patient care. I think no other place in the world has better patient care than we do. And it's a special relationship with the other doctors at Wills. I mean, there's a term, the Wills family, which can sound corny, but really is what we're all about here. If I see a patient and I need them to be seen by a retina doc or glaucoma doc or plastics doc or oncology doc, I can call them up and say, hey, can you take a look at my patient today? And they may be very busy, but they will always see that patient that day, and they will take excellent care of them. I mean, I know that my patients will get excellent, not only cornea care that I and my partners give, of course, but whatever care they need for their eye in a wonderful setting.